Hi, everyone. Good afternoon. I'm so happy to be here with you, and thank you so much for spending your lunch hour with us. We are excited to share a lot of great information all about what we do here in the office and sort of the latest and greatest now in skincare and how to keep you looking like the best version of yourself. So today we're going to take the approach of walking through the decades, which is super exciting because it's a common question that I get in the office and don't get to address as thoroughly as I would like to. And so first, we're going to go over some examples of the types of patients and concerns that I see on a day-to-day basis, and then we'll walk through skincare in your 20s and your 30s, 40s, 50s, 60s, and beyond. So I'd just like to give a brief intro about my background and my history. What am I doing here in Rochester, serving this wonderful community? So I am a board certified dermatologist. I did a fellowship year of training in Boston at a practice associated with Harvard and Yale Schools of Medicine. And during that year, I learned all about the science of lasers and laser technology. In fact, I participated in a number of clinical trials that led to the launch of a lot of the lasers and technology that we're using today. And I also learned all about injectables and the science related to those. So neuromodulators like Botox, Dysport, and also fillers, hyaluronic acid-based fillers, and also biostimulatory fillers. So I dedicated a portion of my training to dive deeper into that realm of medicine. And I'm happy to share that with the community here in Rochester. I'm also the director of cosmetic and laser dermatology at the University of Rochester Medical Center, where I work with residents and teach them all of my knowledge, and really try to train them so that when they go out into the workforce, they're ready, they feel confident about being able to offer these procedures. Um, and so at the University of Rochester, I am an associate professor of dermatology, and I also serve as the diversity and inclusion officer. In the picture, you can see I have a family. I have three young children. I also try to maintain my social media so that I can educate you if you're not able to come in. My goal really through that is to educate. And I do a lot of traveling and conferencing. I'm on what you call the speaker circuit, so I do a lot of talks nationally and internationally. So, aesthetic dermatology is an interesting field. And I say that because there are so many ways to access some of the things that we do in this practice in more of a medical setting. But there are lots of options when it comes to aesthetics, and it can be a very confusing and overwhelming feat. In my office, I see a range of patients from, teenage years, we treat acne and acne scarring, all the way to 80s and even 90s in some cases. And it is my absolute pleasure to treat these ranges of ages and to be able to offer the services I do that are tailored to each decade, if you will. So an example of a 20-year-old patient, I see a lot of patients who come in their 20s. They are right in the thick of social media and influencing. They have a lot of questions about skincare and prevention of some of the common early signs of aging. And so my goal in that population is to guide them and to help them start with little tweaks in their skincare to prevent. Now, in the 30s and 40s, I might encounter patients who have just had children, tired mothers who have dedicated maybe the past 6 years of their lives to being pregnant and producing children. And in that population, they really want something to help them feel refreshed again. They don't want to look so tired all the time. And you look as good as you feel. And so when patients look good, they're able to walk into a room confidently, re-enter the workforce. And that's really my goal in that decade. And then in the latter decades, I see a lot of patients who spent the last 10 years taking care of their sickly spouse or maybe a grandparent or maybe their own parents. And these patients really want to get back on track with self-care, taking care of themselves. So this is not something where we should be looking at it as being vain or ashamed to come in and ask these questions. We really do serve the gamut of all of these of all of these decades, the concerns that go with all of these decades. And really, it's our pleasure to help you along. Now, the American Society of Dermatology is one of the most well-respected societies comprised of dermatologists who have similar training as I do, both in surgical dermatology and aesthetics. And every year they do a survey. And in this case, last year in 2023, they surveyed over 3,000 consumers. And this is just to show you that you are not alone in these concerns. So, these patients who are seeking cosmetic care, dermatologists were the number one most influential doctors, and these were the ones who patients were seeking out. So, really, to start with a board certified dermatologist, you can't go wrong. The top factors in provider selection were price, specialty, before and after photos, referrals, level of licensure. And dermatologists were the physicians of choice for these things listed. Some of the most common things we do: injectable wrinkle relaxers, injectable fillers, platelet-rich plasma for both skin rejuvenation and hair loss. And you can read the rest for yourself, but dermatologists are the leading provider of these cosmetic aesthetic procedures. So it's important when you're looking to get some of these services that you do your homework and make sure you're going to somebody who's credentialed to offer these services. After all, it's your face, it's your skin, and you don't want to take risks when it comes to putting things in your body. And so, where are we getting all of this information? Digital influence is huge. I don't have to tell you that. You're here on the webinar and somehow you heard of it, whether it be a Facebook ad or an Instagram ad. But 84% of consumers say that they, the decisions they make in pursuing aesthetic care is based on what they see online. And so you can see all the different digital platforms that are out there. And this is just really a slide to caution you that there's so much information out there, and there are a lot of people claiming they're influencers or they know this and that about skincare. But again, do your homework, make sure that who you're following or watching or getting info from is a board certified physician. And then if you want to ask questions in the office about things you heard on social media, we are more than happy to answer and debunk those myths. And so let's get started. The key question is, why does aging happen? Why do we see the changes on our skin that we do? And there are really two major categories. So there are internal factors, which are things that we can control, like the total sun exposure, pollution, stress, illness. These all contribute to aging changes. And then those are the external factors. And then there are internal factors like physiology, genetics, skin type. External things are things that you are exposed to, right? So the sun, pollution, stress, all of the things I mentioned. And internal are things you don't really have control over, like what you've inherited, your physiology, your skin color, your genetics. And these are all factored in when we think about why the changes happen on our skin as we age. So when we think about aging, we can describe a youthful face as having the triangle of youth. So we see high cheekbones, a very defined jawline, a lifted mid face, and really the focus is on the eyes. And then as we get older, this is a mother and daughter. The daughter is age 26, the mother is age 64. As we get older, we describe that aging face as looking like an inverted triangle. And so there's a lot of heaviness around the jawline, a little bit of jowling. The focus is less so around the eyes, but more in the lower face. And often we have patients come in and complain that they feel like they're looking sad all the time, that their face looks heavy. And this is something that we really would like to help with. And the key here is to prevent this before it starts getting to a place where surgical intervention might be necessary. So as I showed in those pictures, you might think like, oh, well, that's just changes due to gravity. As we get older, our skin sags. And that's really not the case. So there's multiple factors at play. There's multiple factors in play when we think about why our skin changes the way that I just showed. So in addition to loss of bone and fat pads, we're also losing collagen and elastin. In fact, all of these things combine lead to the changes that we just saw. So let's talk a little bit about the changes in the bone. So as we get older, we lose volume in our bone, and that's because it starts resorbing or shrinking. And around the eyes, the bony support that sort of supports our orbit will start to widen, and that's why our eyes look a little bit more hollow, and that's why we get what we call tear troughs or volume loss around the eyes. The other thing that happens is our mid-face starts to kind of shrink in, and so that's why we see a lot of volume loss right at the corners of our nose, and we start to develop these nasolabial folds because of the resorption of that maxilla, we call it. So the maxilla and the mandible, right? And so the lower part of our jaw, which is the mandible, also starts to resorb, and we lose that bony structure in which our skin sort of drapes across. And so it starts to show these signs of jowling. And that's all really partially due to changes in the bone. The other thing that can happen is our fat pads. In the lower photo, you'll see we have multiple layers of fat pads, and our fat pads will shrink and shift. Now, especially if you've gone through a lot of weight loss, so a lot of my patients now are on these GLP-1 inhibitors, so they're going through extreme weight loss, and you'll 100% see that in your face, and that's partially due to your fat pads shrinking. And so all these things together, you see these signs of aging that we will strategically address. So now let's jump right into the decade. So skincare throughout your life and how it changes through each decade. So starting with the 20s, really in this decade, and I mentioned it a little bit when we started, the goals here are preventative care and establishing healthy routines. So the number one thing a 20-year-old, even younger, needs to know is they need to be wearing sunscreen. Why? Because sunscreen will help prevent the effects of UV radiation on the skin, which leads to collagen degradation and the development of brown spots and potentially the development of precancerous lesions, even as early as your 20s. And so sunscreen is key in this decade. And again, it's about forming habits too. So if you find a good sunscreen early on, you're going to stick with it through the rest of your life. The other thing we start to see in our 20s is hormonal changes, hormonal type acne, and acne kind of left over from teenage years. So I have a lot of 20-year-old patients who come in worried about blemishes on their skin or the leftovers of acne. I don't want to say scarring per se, because a lot of times this can be reversed, but there's evidence of acne on the skin. Things that we can do to help treat and prevent these changes. Can you go back, please? Thank you. So things that we can do to help prevent and treat these changes on the skin that we see are chemical peels, preventative Botox. I'll show you a little bit more in depth about these procedures. And we can also recommend products in addition to sunscreens like lightweight moisturizers and retinol. A lot of trendy things that are happening in the 20s are these natural and clean beauty products. That's great if that's what people are drawn to, but it's important to note that natural and clean beauty products don't necessarily mean better for your skin. And so that's a conversation I like to have in the office. I ask patients to bring in their skincare. We read through the ingredients and we decide, are these products right for you? Next slide. So on the left, you're going to see an example of me doing a chemical peel. Now, this is a patient in her 20s who was concerned about pore size, a little bit of texture change. She had a little bit of acne. And so we can use things like salicylic acid peels and glycolic acid peels, which not only help to hydrate the skin, but they help to gently chemically exfoliate the skin without you having to scrub. There's really minimal to no downtime, and they can be performed monthly. Here's another example of a patient who has some more severe acne scarring, and you'll notice she has a little bit of darker skin. These procedures are safe across all skin types, and in fact, I consider myself an expert in treating all skin tones, and so everything I'm going to show today, just know that there is a way to treat all skin tones safely with a lot of these devices that we're using in the office. So now in the 30s, so we're starting to see in the 30s early signs of aging. So some of my 30-year-old patients will start to develop etched lines across the forehead or those frown lines in the glabellar area, which is here where most people know as the 11s. And you'll start to notice that you frown or you squint and those lines stay in the skin. And so this is the time to really think about things that will help to stimulate cell turnover so that the skin is always producing collagen. And if I didn't mention it before, as early as age 26, you start to lose about 1% of collagen per year. And so everything we do in the office throughout the decades is really to help stimulate collagen and elastin. So common treatments that we can provide during this decade are things like microneedling, low energy lasers like the Clear and Brilliant, IPL or BBL, which stands for broadband light treatments. And all of these treatments can help with gentle skin rejuvenation, resurfacing, and also lifting brown spots and sort of the early signs of aging off the skin. Something we see a lot of in this decade is melasma. This is a decade where patients are getting pregnant, starting to think about having children, and they're going through a lot of hormonal shifts. And melasma is a condition that can occur during pregnancy and then persist for many, many years. And so it's important to kind of get a hold on it early on. And if you start seeing this looks like patchy dyspigmentation or brown patches on the skin. If you start to see this in your 30s, it's definitely worthwhile seeking advice from a board certified dermatologist to help prevent it from getting worse. There's also hormonal and postpartum changes, fine lines on the forehead, as I mentioned. So this is when we start to talk about retinoids, really prescription-based retinoids to help stimulate cell turnover, and serums like vitamin C serums that deliver antioxidants to the skin to help prevent those early signs of aging. Now, this is again trendy in this category. We start to develop personalized skincare routines and using innovative ingredients like peptides and nanoparticles. So next slide will show you some of the common procedures we do in this decade. So injectables and fillers. Of course, I have a lot of patients in this decade who are looking to get some natural enhancement of their lips. Um, I like to say I don't know how to make you look fake or inject to where your lips look big or ducky. And so, really, a natural aesthetic is possible when you're using injectables and fillers. If you look on the right, here's a patient who had some mid-face filler, and you can see her cheek has been lifted. She's in her 30s and an athlete, so she's starting to notice those shifts of fat pads in the face. And we filled her nasolabial fold as well as the cheek to kind of give her that lift and put the volume back where it belongs. Then you'll also see the effects of neuromodulators or Botox on some of these forehead lines and frown lines in this patient. And on the bottom, we're showing a before and after of something called Kybella, which is actually a treatment for double chin. And so this is also a decade in your 30s where I see a lot of patients trying to address stubborn areas of fat on their skin and look toward more body contouring procedures. So in the next slide, you'll see we also offer a procedure called cool sculpting. And this is a procedure where we use the scientific name is cryolipolysis. So we use a device to selectively freeze fat cells where we can treat stubborn areas of fat. So you're seeing here a 30-year-old man who is active, he works out, maintains his diet, and just can't seem to get rid of those love handles. And so we can use cool sculpting to help with that process. And we can also treat a little bit of fat under the arms as well as back fat and bra fat, which is depicted here. Other areas we can treat belly fat, submental fat, which is double chin area, as well as what we call saddlebags or sort of the pockets on the thighs and the inner thighs. And we can also treat what we call the banana roll, which is that little area of fat right under the buttock. Now, this is the #1 FDA approved fat reduction treatment in the US. It's been around for over 10 years and is in more than 90 different countries. So the safety profile has really been established with this procedure, and it is very effective. And I say patients who come in early and are really looking for ways to improve their body and address those stubborn areas of fat is this treatment is a no-brainer. Okay, so now we're moving into that kind of mid-decade, the 40s, where we see a lot of crises, right? So these patients may have just had a bunch of children and are now, like I mentioned earlier, looking to get back on track with skincare or really seeing those signs of aging in terms of volume loss. And so this is when we really try to think about biostimulation with fillers, starting neuromodulators like Botox, Dysport, Xeomin if they haven't started them already. And this is when we can get into some of those more hard-hitting procedures, which require a little bit more downtime. But like I say, you're going to get more bang for your buck. And in this decade, let's be honest, 40-year-old women, men, they're in the thick of their careers. They don't have time to have a lot of downtime. And so here we suggest doing treatments that really make a difference where you invest that time and then you don't have to come back for maybe 6 months to a year. Because as you remember, everything we do requires maintenance, just as I described at the beginning with the reason why our skin ages. We're not just going to turn back the clock with one treatment session. So everything I'm talking about today, think of it as a maintenance plan. So in your 40s, we're also starting to see hormonal changes like loss of estrogen. So when we lose estrogen, we lose that lipid barrier, that cushion, that hyaluronic acid. We lose collagen, so our skin becomes more dry, our pores become more enlarged. And so we really have to address those changes with thinking about hormonal replacement therapy, which I personally don't prescribe, but we have colleagues who do at the university, and also addressing those changes with lasers, things that are implementing more permanent type changes in the skin. We can also think about skin tightening at this age. I feel like this is a decade where patients are at that crossroad of should I get a facelift or should I stick with minimally invasive? And again, if you start early, the goal in my practice is to help prevent you from going under the knife. And so here I'll show you an example of some procedures in the next slide that we can do in your 40s. So this is a great example of laser resurfacing. We are using a device called the Halo, which is a fractionated ablative and non-ablative laser. And what are we addressing? We're addressing the neck. And so when you think about all the things that age, it's not just your face. We also have to think about the neck, the backs of the hands, everything that's visible under everything that's visible when you're clothed. Here is a really nice example. You can see this patient's eyes are shown here. We did one session of fully ablative laser resurfacing to her eyes. She was starting to feel like her eyes made her look tired. And you can not only see the improvement of the crepiness under the eyes, but you can see that we did give her a little bit of lid lift on the top without surgery. Now, this isn't a procedure that, these results don't happen overnight, obviously. These pictures were taken about 6 weeks after the procedure, so she's still pink. But there is some downtime associated with this type. If you want this type of result, one treatment, there's definitely downtime, but it's worth it if you don't want to have surgery. Then the next picture, this is a patient who was worried about enlarged pores, overall texture. She'd had some acne in the past, and you can see that in her eyebrows are microbladed, so you can see that piece of makeup, but she's not wearing makeup in the after picture. Her skin looks like it's been airbrushed. And that's really the result that you can expect from a treatment with the Halo. Halo stimulates collagen and elastin. You get this radiant, smooth, healthy looking skin. We can use it for acne scarring, fine lines, wrinkles, and texture changes. And like I mentioned, it helps to minimize that pore size and also with discoloration. Something else we can do in the fourth decade is injectables and fillers. So here you see a patient who is noticing some volume loss in her temples. This is a common area where we lose volume as we age, but it's also a common area that's missed in the consultation. And it's not something I see patients come in and say, oh, I'm here because I want my temples filled. That's something that we, look at together in the mirror and notice that as we get older, our face starts to look a little more skeletal and hollow in the upper face. And so this is an area that we can address with injectables. Now you see here in the before and afters, we're seeing a patient who had a treatment with neuromodulators and some microneedling. And so not only is the texture of the skin improved, but the brown spots are also improved. We also can enhance lips, like I mentioned, naturally in any decade. But you can see here, we were helping this patient who we did her lips on with facial balancing. So she had really nice eyes and a prominent forehead and a more oval shaped face, and the lips were just getting lost in that. And so we enhanced her lips and it really gave her a more natural kind of balanced look. And then on the bottom, you can see another place we can inject are the hands. So our hands start to go through all the aging changes as our face. And so we can use some filler and also lasers to help with all the brown spots that start to develop on the hands as well. Now, in your 50s, so remember, it's cumulative. So it's all of those things that we mentioned, but now we're just adding little by little other things that can help. And again, if you start early, you won't need all of these things later on. You can just sort of maintain. And so it's actually easier on your budget because that's a thing to consider. Now, in your 50s, the goal, all of the things above, and then also restoring elasticity and managing that dryness that we mentioned happens with the hormonal changes and the loss of estrogen. And this is also an age where if you had a lot of sun exposure in the past, so you have a history of indoor tanning or blistering sunburns as a child, or you just didn't practice healthy skincare habits until maybe your 40s or 50s, we start to see these little precancerous lesions starting to pop up. And we call these actinic keratoses. And so these are like rough pink spots on the skin that maybe in the shower, they'll kind of slough off with washing, and then the next few days you see them pop right back up. And this can be really frustrating for patients, but it's also a telltale sign that you need to seek help from a dermatologist. We have a number of ways to treat actinic keratoses, but one of the things I do in my practice is laser resurfacing, which you just saw. And now we know there's data that with regular resurfacing, so, once every 6 months, twice a year, we can prevent the development and reoccurrence of these non-melanoma skin cancers and precancers. And so there's actually a medical sort of clinical advantage to starting early with procedures like the Halo or like a Fraxel, for example, if you've heard of that device. Other things we can do in this decade are tightening procedures. We can start as early as our fourth decade, but really hone in on this in your 50s and recommend richer moisturizer, serums, and even facial oils. And so here's an example again on a male patient who is having a halo procedure. This is that resurfacing procedure that I mentioned. Um, can you go back, please? Thank you. And so we can do halos as early as your 30s for acne scarring, for example, or as late as your 50s and beyond to help resurface and also address those signs of precancerous change. I really think devices like this, and I don't think I know, devices like this help with overall skin health too. Your skin looks brighter and it just looks healthier. It looks more radiant. We're stimulating collagen, all the things you need to maintain healthy skin as we age. Now you can see in these before and afters we were able to use some biostimulatory fillers in this picture of the patient with the chin area being filled. Obviously, she has a lot of volume loss. Maybe a facelift, is an option for her, but she did not want that. And so we used 2 syringes of Radius and really filled this area of her mandible and chin. And she has a nice, natural looking result. It doesn't look fake. It just is replenishing what she's lost over time. And then the patient on the right, you can see a lot of sun damage over the years, a lot of brown discoloration. We did the BBL combined with the halo in this patient. You can see that this is just after one treatment. Her skin is really just glowing and radiant. This treatment for her was game changing. And again, she only came once. This was after one treatment with those 2 devices. And so, yearly maintenance treatments are recommended, but you can see the kind of results we can get with one treatment as well. Now, we talked about skin tightening. So this is our procedure for skin tightening on the left called SoftWave. It's an ultrasound-based skin tightening device. We usually treat the entire face and neck. We can also treat other areas that are prone to laxity, like the abdomen, postpartum abdomen, or right above the knees. This device, the beautiful thing about it is that there's zero downtime. And so you can have a treatment with the SoftWave and go straight back to work. Now, this is my lovely nurse Tracy you demoed here, and she looks a little pink. We do pre-treat you with topical numbing cream, and that's probably why she looks a little pink. But after the procedure, really, you can go straight back to work. Now, on the right, you see a patient who's lost a lot of volume under her eyes, and her face is starting to have that inverted triangle that we described at the beginning. And so we placed a little filler in the mid face only, so in her cheek area along her zygoma. And you can see that even we didn't even treat her eyes, but that area looks improved with just one session of filler. And now this is something that will last her about a year and she'll need to come back for maintenance. But this is a good natural start. She was very happy. And in fact, she ended up coming back for neuromodulator treatment. So we did a little bit of Botox in her forehead and her glabella. And so in your 60s, it's really about maintaining. Okay. So we are going to continue using these minimally invasive devices. And I should really say 60s and beyond because it doesn't stop at 60s. I still have patients coming in their mid 80s for their routine Botox treatment, and that is perfectly acceptable. If that makes them look and feel better and be able to go out there and be confident and, socialize with friends and work out and all the things that they're hoping for as we get older, then it's worthwhile. Now, in this decade, we also think about maintaining with biostimulatory fillers. Those are fillers that help to stimulate collagen over time. And so we typically require 3 sessions. So this would be Sculptra or Radius. We require 3 sessions spaced about 6 weeks apart. And this is a great option for maintaining the skin without the risk of over plumping or overfilling. We're recommending all the products we recommended, but now more sort of gentle, really hydrating products to help with that dryness on the skin. And it's really important in this decade, and I'm seeing it within our field even, that we advocate for mature skin inclusivity in beauty standards because most of these new beauty products are advertised for the youth and maybe 30s 40s, but we really don't see a lot of mature patients when these new beauty care products come out. And so I'm with you, and I think it's really important to be an advocate for representing this decade and beyond. So now, in sum, what we just described were the 5 pillars of anti-aging treatments. And so if you took nothing from that presentation, or you're all confused, or it was too much information, you want to take a screenshot of this slide, which sums everything up. What we aim to do is repair the skin from the changes due to sun damage over time, which is loss of collagen, loss of elasticity, brown spots all over the face. We aim to relax the muscle action because with consistent negative emotions like that scowling, frowning look, we do develop angry 11 looking lines on our face. And that's one of the most common complaints I hear is patients say, I feel happy, but everybody says I look angry. And so if we can relax that muscle action with our neuromodulators, we can help prevent the development of those lines becoming etched into the skin. Our next R is restore. And so we're trying to restore all that volume loss due to the bone resorption and shifting and shrinking of fat pads. We do that with our biostimulatory and hyaluronic acid-based fillers. We resurface the skin texture, which I mentioned help with preventative in terms of developing non-melanoma skin cancers or precancers. We do that with the halo. We also resurface fine lines and wrinkles and acne scar, any scarring or textural changes on the skin. And then with our skin tightening devices, we're able to redrape the skin in a sense in a non-surgical way. And that's with our soft wave. And then I kind of did this backwards, but if you look on the left, you'll see there the 5 R's of anti-aging and then a number of skincare products that I recommend. So if you take a screenshot of this picture, you can do a hard press on your phone, and the link to that QR code will pop up. And it's a website called Howl that will direct you to all of my skincare recommendations. Now, I have a lot of, let me start over. Well, I love to educate, is what I was trying to say. And I'm very passionate about making sure that my patients are educated and that what we're putting out there is true and science-backed information and not just what influencers are saying who are not credentialed. And so this past June, I decided to start a YouTube channel where I go over different conditions and different questions or maybe debunk some myths that I've heard online. And so I really encourage you to take a look at my YouTube page. The link will be on the next page. But in some of these videos, you'll see we talk about counterfeit Botox, we break down melasma, we talk about why our skin ages, hair loss. So if you have some more questions after today's webinar, I really encourage you to take a look at this page because everything is sort of summed up there. And don't forget to subscribe so you'll be notified when new videos and new information come out. So now I'm happy to take your questions. Thank you for your attention. Thank you for hanging on with us for this long. You can enter your Q&A questions in the box below, and we will go ahead and start answering that. And then I'll have Melissa chime back in to talk about scheduling an appointment if that's of interest.
So we have a couple questions, Dr. Weinstein, about cost, and if you could address the investment with some of these treatments, specifically injectables and fillers and lasers.
Yeah, absolutely. So that is a loaded question. We're talking about cost of some of these procedures. I would say in terms of budget, so your neuromodulators like Botox and Xeomin and Dysport range from about $400 to $700, $800, and that's per treatment. It's variable based on how many areas you're getting treated and how often you come in. So I'd say the majority of my patients come in 3 times a year, and they're spending on average about $550. And we are also very open to working with you on your budget. So, we can really prioritize the treatments that will help to maintain your skin over time and talk about how budget factors into that. In terms of lasers, so as you saw, there's a whole range of different lasers we offer. Something like a halo is going to cost about $1,500 to $1,800 in our office. And, we do recommend 2 treatments. We are able to offer discounts if you buy them sort of together. But as a rule, I don't really offer package deals. I really don't believe in that. I don't think that anybody's face or skincare is summed up by a package or can be addressed with a package. And so a lot of these treatments, as I mentioned, I like to customize. So maybe we'll do this treatment and then we'll combine a few and then we'll go back to another one. So I don't do bulk packaging. Our skin tightening devices are the most expensive, but they also require the least amount of office visits. So for a skin tightening device like the Soft Wave, we recommend you come in twice a year or once a year. A lot of patients like to give it to themselves as a birthday present, or they ask for it as a holiday present. And so that's something that is going to be sort of in the, thousands range that will need to be planned for.
Okay, we have a question about preventative Botox, and what age you recommend starting and what your thoughts are about that.
Yeah, so I was just talking to somebody earlier about this. So I can give you a real life example. So I started at age 26 and have been doing little bits, over the years to prevent the development of etched lines on the skin. The reason being for this, early start point is that we know that collagen starts degrading, or we're losing about 1% of collagen per year as early as our late 20s. And so as we make these repeated expressions, we're going to develop etch lines on the skin. And the real point of preventative Botox is to prevent those lines from occurring. And there are some myths out there that it's not good for you or weakens your muscles, and certainly in some areas, or if it's injected poorly, there are definitely side effects that can occur. But as a preventative measure, starting early with less over time, I think is perfectly safe and acceptable. The other thing with neuromodulators is over time, the more you keep up with your injections on a regular basis, so we're talking like 2 to 3 times a year, your muscles have memory. You've heard that before. And so you'll you'll sort of um, forget, if you will, how to frown as strongly as you used to. So that frown expression will not be a part of your facial expression anymore, or it'll be more subtle, which is not a bad thing because we know from our psychology and psychiatry literature that when we make that frown or that angry face or that scowly face, it actually gives off a negative emotion and negative feelings. And it can actually, too much frowning can lead to depression. And we have seen in the psychology data, like I mentioned, that when we treat this area, people feel happier. And so it's no surprise that we have patients who come back regularly for this treatment to help with their mood as well.
We have a question. Do you approach African American skin with the same approach when using sunscreen? And how important is it to use sunscreen if you have that type of skin? Should it be used in the winter as well?
Absolutely. So African American skin should be treated the same way when it comes to sunscreen as any other skin type. And I'll tell you why. Even though you are less likely, African American skin patients or darker skin patients are less likely to develop your normal type skin cancers that we see more in Caucasian patients like basal cell and squamous cell, which typically occur on areas that are exposed to the sun. So like the nose, the ears, those are common areas for skin cancer. So yes, darker skin patients are less likely to develop skin cancer in sun exposed areas. But that doesn't mean that they're not subject to the effects of UV irradiation, just like everybody else. So UV irradiation causes degradation of collagen. It can cause discoloration, dyspigmentation on the skin. It can also uh, break down elastin and lead to that sort of sagging look of the face because that's all due to elasticity and collagen. And I'll tell you, in my darker skin patients, the number one complaint or concern that I hear is discoloration. So their skin is uneven, the skin tone is uneven. And so wearing sunscreen will help to prevent your skin from becoming uneven and to maintain a natural overall sort of even tone and also prevent the development of accelerated aging changes on the skin. And just as a caveat, darker skin patients can still develop skin cancer. They typically develop them in areas that are less exposed to the sun, like under the nails or in the genitalia or on the feet, the bottom of the feet. So it's still important, even if you're a darker skin tone, to come in for skin checks or just check your skin regularly. The famous singer Bob Marley died from melanoma, which is a skin cancer, and it was on his toe under the nail. He thought it was a bruise because he was an avid soccer player and it happened to be skin cancer. So I always tell that story because I think it's important for everybody across all races and skin tones to check their skin regularly.
We have a question about rosacea and if lasers can be used with rosacea.
Yes, absolutely. And I didn't mention that per se because we see that across all decades, but rosacea or facial flushing or redness on the skin can be treated with lasers. In fact, the pulse dye laser, which is one of the lasers we have, it's called the V-beam, the brand name. That is sort of the gold standard for treating rosacea when it's purely due to dilated blood vessels on the skin. So typically recommend a series of treatments spaced about 1 month apart, and we will treat with a pulse dye laser. And sometimes I'll combine it with a BBL, which is the broadband light device.
And a question, what specific products do you recommend for discoloration from tinea versicolor on the lower back and redness from keratosis pilaris on the
Yeah.
arms?
Yeah. Those are great questions. I'm not able to give sort of medical advice without assessing the skin. And so I'm happy to see you in the clinic and suggest products for that. What I can say is that tinea versicolor is due to yeast on the skin. So a lot of the products we recommend are to target yeast. So the anti-yeast products over the counter, like a selenium sulfide or a Head and Shoulders type of thing as a body wash. So and then keratosis pilaris is a type of eczema, for those of you who might have not heard of it. It typically presents as like chicken skin or plucked chicken skin, like roughness on the skin. And for that, we typically can recommend something over the counter like M-Lactin. But those are just the broad categories of those conditions and what we might recommend over the counter.
We have a couple questions about at-home devices. Do red light and radio frequency devices work, or are there any at-home handheld lasers you could use?
Yes, absolutely. So I love this whole trend of at-home devices. They're pricey, and so I get it. It's worthwhile knowing how good of a job it's going to do for you in your own home. I think the rule of thumb is really know thyself, right? So know whether or not you're going to take the time every day or whatever the prescribed treatment regimen might be. But typically it's a time commitment at least 3 times a week. So 30 minutes 3 times a week or every day to apply the device, whether it be a microcurrent or a red light mask. I find that in this day and age, most people don't do these things regularly. And it's nice for like a self-care Sunday, or, if you're on vacation, you brought your red mask, your red light mask. But if you're not doing it every day, you're not really going to see any significant change. Now, that said, a lot of the patients I see in the office, if they have at-home devices, I do recommend, I say, we just did a halo or we just did a soft wave, we just did the skin tightening procedure. Now go home and use your at-home device regularly to help maintain the results of this procedure. Now, I don't have data to share with you to say, if you do your at-home device after a soft wave, you'll have even more long-lasting results for 2 years. I mean, we just don't have that data. But we know that there is data to each of these devices. So some of them have been thoroughly vetted and studied. And so if you use them after in-office procedures regularly, I do believe they will help to maintain your results.
We have time for one more question. Um, Someone was asking if you offer facial balancing, or if you could describe that, maybe.
Yes, I do. We do facial balancing with our injectables. And so that's really where I like you to bring in pictures of what you looked like when you were younger. And we try to identify the specific changes that are going on in your skin and your face and rebalance kind of where things put things back to where they used to be. As an example, another thing we do, and I showed you the picture of the patient where we filled her lips, we're able to evaluate your face and see what areas can be enhanced so we achieve a more balanced look. Now, some things we learn in training are, complex measurements of and proportions of how a face should look. And all of that is important. But at the end of the day, everybody's face is different and unique. And I think it's really during that special time, one-on-one in the clinic, where we talk about what things we can do to make subtle differences to achieve that facial balance without looking fake or weird or different or enhanced. And I'll just put a plug in, a lot of the things, a lot of these questions you asked, which were amazing, thank you, are addressed even more in depth on my YouTube page. So we just launched um, a new newsletter called The Expert Aesthetic. And we hope that you will all sign up to receive it. And we're going to go over all the latest trends, debunk all the myths, and link to some of the videos that we've filmed over the course of the last few months and give you access to that. So we're so happy for you to become a part of our community. And with that, I guess we'll close the webinar. Thank you all for joining. Thank you for your questions. And I hope you're able to drop your info in the comment box so that we are able to grab that and help you schedule appointments or answer any more of your questions. Thank you so much.